Kia ora koutou, ngā mihi kia koutou. Firstly, Julian and Hein, an acknowledgement of you, and thank you for having me here. And particularly, Hein, I would like to acknowledge your service. I understand you're outgoing in March after 7 years of service, and you know that your union is well regarded across the sector. So I particularly wanted to thank you for your role in that. The strong leadership I know is widely appreciated. And thank you also for the work that you do in your community, for working with the most vulnerable, which is also widely acknowledged. So I just wanted to say that up front on a personal note. Thank you for your service. And thank you for inviting me to address the conference today. As the incoming Minister of Health, I'm talking to as many people as I can and taking as many opportunities as I can early on, just to speak with people across the sector. And so it is really, truly a pleasure to be here today. It would be remiss of me also not to acknowledge the Honourable Annette King, who I understand is here today also. Is Annette here? I am rightly informed, aren't I? There's a wave. Well, she might be appearing later. Either way, she is someone who, of course, needs no introduction to you, and you will know of her significant contributions during the time of the previous Helen Clark government. And I was privileged to serve as her understudy for the years that Labour was in opposition, for 4 years of those. And that taught me a lot. And I, of course, recognise there's still a lot more to learn. And I'm sure I will still continue to receive plenty of advice from Annette. One of the things that I particularly valued, though, about her mentoring in my time in opposition as her associate was looking at the breadth of relationships she had across the sector and the people she was able to introduce me to during that time. And that's something that I hope that I can pick up and run with myself to develop those relationships, because I think that was a big part of her success as the Minister of Health. And I'd like to acknowledge at the start also all of you. I'd like to acknowledge ASMS members, international guests, and other speakers at the conference. And I really do hope you enjoy the program that has been put together for you. I also realise that I haven't met all of you yet, so I'd like to take a moment at the start just to briefly introduce myself and about how I ended up here, say a little bit about that, both as a Member of Parliament and as the Minister of Health, because that will probably give you some context for understanding some of the things I say in the media. Probably not all of them, but some of them. I took a particularly circuitous route into politics. I studied for a very long time at university, so I guess you could say I was a slow learner. I originally am a Minister of Religion. I'm still a Minister of Religion, although that mainly today is for family and friends for funerals and weddings. Unfortunately, my current role doesn't allow a lot of time for much beyond that. I've spent time running a hall of residence at Otago University, which I guess is the equivalent of running a small, medium NGO, about 40 staff, mainly part-timers, and reporting to an independent board, but a very enriching experience. I'm sure there are probably some people here who have spent time at Selwyn College over the years. I've also worked at the Treasury, and I'd ask you please not to hold that against me. And it was while I was at the Treasury that I became more interested in politics. I got a little frustrated at times that Michael Cullen wasn't taking all of my excellent advice, and I went across the road and spent a year in a minister's office to try and work out how decisions were really made in New Zealand. And what I learnt during that time was that government in New Zealand has an enormous influence on the shape of our society. In contrast to other democratic jurisdictions, the ministers of the Crown can make decisions and can implement them, and can do that in prompt order. So they have an ability to affect the well-being of citizenry in quite a direct fashion. And so for me, that meant after that time, I thought this may well be a possibility for me. So when Pete Hodson, who was the Member of Parliament in Dunedin North, retired after 21 years, I think, and 23 portfolios as a minister, including Minister of Health, I put my name in the hat, and then went through the democratic process within our party, and then into Parliament through the electoral system. And so that's kind of how I've ended up here. I think the other important thing to say is that the thing that motivates me is a concern about growing inequality in New Zealand. That is the reason that I've really chosen to be involved in politics, and you will know about that, of course, in your sector. And I figured that I could either throw stones on the sideline or I could get involved and try and be a part of making change that made a difference, a real difference in people's lives. So I chose to get stuck in. And when I reflect back, it's not that long ago that New Zealand was a very different place. And I know that because of my parents' story. As a child, when I was about 9 years old, my father started his own manufacturing business. And for a number of years, that had very low turnover. It turned into a successful business, and some other businesses subsequently. But around the same time, my mother went back to high school, spent 2 years in high school finishing off high school, which she hadn't done previously. She had previously been a nurse but hadn't been required to finish high school to get there. Then she went to university for a year, and then eventually she got into medical school to train as a GP. And that meant that as we were growing up for those few years, there was very little household income. Now, my parents during that time were able to start a new business, go back to school at the same time, maintain a mortgage, and raise 2 kids. It's pretty bloody hard to imagine that happening today. 2 of those things possibly. You know, it is possible to imagine people juggling a couple of those things if they've managed to save some money before. But the world has changed in 1 generation for New Zealanders. And I think that we can do so much better than we are now. I think we need a country where people can make the best of their talents. That is important for us, for our social well-being, but also for our economic well-being as a country. So my mother, as I said, went to medical school. She's actually a real doctor. And I spent quite a bit of my summer holidays going to medical school as well as a student. As I was about 12 at the time. But it gave me a window of opportunity into that world, and it gave me lots of connections. Her medical school class and so on became people that I knew as a teenager growing up. And so from a very early age, I have had an interest, a deep interest in the health sector. The inequalities picture is supported, of course, by statistics. In December 2014, the OECD put out a report that said, in New Zealand, our inequalities are not the worst, but they are growing faster than any other single OECD country over the past 3 decades. And I don't think New Zealand should be a world leader in inequalities. That's something I think we need to change together. Every day I hear stories, just about every day, of people who are presenting at emergency departments and so on because they could not afford to go to their GP first. They could not afford to go and get the primary care they needed in whatever form before it was too late and they had to be sent in an ambulance. And a big part of that is because they just simply cannot afford to go. We know that unmet need is continuing to grow in New Zealand. The New Zealand Health Survey estimates that because of cost, over 500,000 New Zealanders in the past year didn't visit their GP. That's their estimate. And that's grown. It's been growing year on year. It's grown since last year. It already hit 500,000 last year. More than 250,000 people in the past year, by their estimate, didn't collect prescriptions because of reasons of cost. And the disparity amongst Māori and Pacifica is even greater. Māori adults were more than 1.5 times more likely not to have visited a GP because of cost. And Māori and Pacific adults and children were more than twice as likely as the rest of the population to not collect prescriptions because of cost. These numbers highlight the individual experiences of some of our most economically challenged people in New Zealand, and the statistics, I think, plainly show that more needs to be done. The experiences are real. My mother saw them when she served as a GP in South Auckland with underserved communities. And it's because people living in poverty, through no fault of their own often, are unable to afford the healthcare they need. And it feels wrong to me. Some people are able to receive healthcare simply because they can afford to access it through insurance and other means. But it isn't what a fair society is about, and it isn't what New Zealand should be about. Every New Zealander should be able to afford quality healthcare, should be able to have access to quality healthcare. And so that's why our government, as a starting point, will improve access to primary care. We've made some pledges about that before the election, and we will follow through on them. And it's not only because it's the right thing to do, but because it's the most effective thing to do from a health perspective in terms of addressing inequalities. And ultimately, in the longer term, it costs us less. Over time, it will free up our emergency departments and hospitals for the most serious cases. It will put people back into productive work and to being constructive and to be able to add to their communities in the way they want to add to their communities. And it means we'll be making meaningful steps to reduce those inequalities. Unfortunately, as you will well know, inequalities in our health system stretch beyond primary care. They exist in secondary care too. And recently that has been getting worse. Our best estimate is that around 300,000 people in New Zealand are not getting the services they need in secondary care. This year, in the past year, we learnt that 60,000 people didn't get their first specialist assessment, and the hospitals, the DHBs, in many cases wrote and said effectively that was because there weren't the resources there to treat those people. These days, in many specialty areas, people are required to be more disabled to receive the care that they need. Their health problems have to deteriorate before they are addressed. Of course, if you have private health insurance, that's fine. You can get the care you need in many cases. But if you can't afford that, you're left with very few choices. And the example of Doug Pike is one that's well known. He was left waiting for knee surgery for 8 years and then sold his house to fund the surgery, only to receive a letter thereafter telling him that his surgery had now been scheduled. It shouldn't happen in New Zealand. It's not the New Zealand I grew up on, where people had to sell their house to get surgery that the system acknowledges they need. And it doesn't have to be this way. The previous government did make choices. They made choices about spending less on healthcare. And contrary to many Western countries, healthcare expenditure dropped as a proportion of the overall economy. So if you look at core Crown health expenditure, it actually dropped as a proportion of the overall economy. In Western countries, it tends to track up with the spending, with the economic growth. And in my way of thinking, that actually had its most detrimental effect on those who could least afford it. So before the election, Labor commissioned a study from Infometrics, who looked at the demographic changes over time, and they estimated that $2.3 billion had been stripped out of the health system by the previous government. And so we've made a pledge that we need to meet cost pressures in the future. And we need to meet at least the same levels of service. That the consequence of not meeting those pressures meant that the thresholds had to keep going up. There have to be trade-offs made in that situation. You all know that underfunding is real, and it places massive burden on staff. And that is one of the things, particularly reflected in your BIM to the incoming minister. I don't know if you read that, but I certainly read it closely. The effect on staff, the burnout, and the stress that staff are under. So I want to acknowledge that it's been your work and the efforts of thousands of other hardworking, committed staff that has been keeping our health system running so well. And I want to acknowledge you all and thank you for your contribution to that. Every day, just about, I hear of stories of people who shouldn't have been admitted because of the way the system's been set up. I also, every day, hear stories from people about how wonderful the treatment was that they had when they got into hospital. People really appreciate our health system. They know it is quality. When you get through the door, that you are looked after and that you're in great hands. And so I really want to thank you all for your dedication in what has been a very stressful and difficult time. Labor does intend to do things differently, and we will begin fixing our health sector and addressing the funding neglect. We'll do it because we fundamentally believe in a strong public health system. And I see my job as the Minister of Health as putting the public patient first. That is my job, to ensure the best outcomes for the public patient. Now, I'm sure for all of you that is the same, but that is my focus. Strengthening our system will require us to do some things differently than the previous government. And we will need to demonstrate to the public that services continue to improve as we invest. So while this might be a time of hope, it is not a time of complacency. We'll first need to rebuild, us politicians and other leaders in the sector, relationships too. That's something else that needs to be addressed. They have been seriously strained, and this has meant that parts of our health system have increasingly been working apart. I'm determined myself to build strong and productive relationships with people across the sector as well as in the community. And that's the leadership role I've set for myself as Minister of Health, and it's my expectation of the Ministry of Health also. New Zealanders expect our health system to work together and to improve health outcomes. And under our government, it will. That is why I've already visited 7 DHBs in 3 weeks. I can tell you the rest of that time has been well spent too. And I've committed to visiting as many as I can before Christmas. I want to make sure that we are all on the same page and heading in the same direction. Our government will also be sure to engage with organisations like yours to better understand the perspectives of people working at the coalface in our health system. And that's exactly what New Zealanders would expect of us. Doctors, nurses, midwives, allied health workers and others all know the issues within the health system. It's time the government listened to you also. On the policy front, I make no bones about the fact that we have an ambitious policy program to implement in health. Up front, we've committed to properly funding our health system. We'll put a much needed $8 billion into health over the next 4 years. Part of this is the money the previous government stripped out. Our health system can no longer continue to take the back seat. In our first 100 days, we've committed to initiating a ministerial inquiry into mental health. We know the system is failing too many New Zealanders at the moment, and it's time we change that. We've signalled that there will be changes in primary care. We need to make sure that we're investing in primary care to treat and prevent illness early. Experts tell us that this is what we need to do better, so we will. And when people ask what drives these policy decisions, our response is simple. We believe that all New Zealanders should have affordable access to quality healthcare. And we know New Zealanders expect a health system that is there for them and their loved ones in their time of need. They expect a public health system that delivers the care that people require and doesn't necessitate people selling their houses to afford surgery by going private. New Zealanders know that health is everything, and it's why the systemic neglect of the past government will not continue under my watch. It's time we did better. Improving this will take all of us. We will need to work together to deliver the health outcomes that New Zealand public expects. That means from me, right through to the Ministry of Health, individual DHBs, unions, staff working in the sector will need to work together towards a common goal to improve health outcomes for all New Zealanders. I'd like to acknowledge the work that ASMS has done to build relationships across the sector, in particular your long-standing commitment to the Health Sector Relationship Agreement. But to repair the damage of the last 9 years and to achieve the change required in the health system, we need everyone to step up. I've been heartened by the conversations I've already had up and down the country, both as the opposition spokesperson and now as the Minister of Health. People are telling me they have an appetite to do things differently and that they are wanting to play a part in that. My message across the sector has been clear. Bring me free and frank advice. I know you'll have no problem with that. But give me the advice. This is my message across the sector. Give me the advice you think I need to hear, not what you think I want to hear. I may not always agree, but I will listen. Because to make changes in our health system, it will require us to challenge each other in order to reach the best solutions for New Zealand people. I don't underestimate the task ahead of us. It really will require our collective efforts. But I'm optimistic that we can get it done and that the health sector has its best days ahead of it. But I know, speaking to people across the sector, that we all have the same goal in mind: to provide the best health services to the New Zealand public. That is the perfect place to start. Thank you very much. So I'd like to turn over to questions, and then we can have a conversation about issues raised and other concerns that you may have. And I think we're cut for morning tea at about 10:30. So we've got a decent time for some questions.
We've got about
25 minutes. Yeah.
Yeah, 25 minutes. I'd like to commend you, Minister, for mentioning things that your predecessor refused to mention.
My second question is, what's your vision for provincial health centres? Are we going to continue to see an amalgamation of DHBs into bigger DHBs vis-a-vis, say, a South Island DHB? And then the third thing is well, for me, for a big picture, I would say the biggest threat to healthcare is climate change, and what your comments are regarding climate change and New Zealand's role to prevent that, to slow that within the world. So there's a bit to cover there, I guess, so my apologies.
Yeah. So I to everybody else, I'll come back another time and answer your questions. Roger, thank you very much. I feel I have a bit to say about each one of those, so and I think they are all very important questions. Sugar tax, alcohol, family breakdown, the social determinants of health question. I think that there's an important case for having health in all policies. So when I sit at the cabinet table, I'm mindful, that the oft-quoted statistic that 80% of the determinants of health, sit outside the formal health system, the things that we can affect and improve things on. And Helen Clark's famous line about the fact that she achieved more for the health of New Zealanders as housing minister than she ever did as health minister. And the good thing, I guess I can say immediately about that, is that my colleagues understand that. That is the reason we're setting out on our ambitious Kiwi Build program. It is something past Labor governments have done, build 10,000 houses a year, I think was done in the 50s and 60s, so we ought to be able to ramp up and do that again. That will begin to address the issue there. In terms of sugar tax specifically, I've said to publicly that I expect to have conversations with the industry, hard conversations. It's not just sugary beverages, it's highly manufactured food and so on. I think we can make changes around food labelling, and I want to interact with the industry. I understand that business likes to have some certainty about how things work out, and I actually think they know how best to get there, but they need to understand that if we don't go down a track which leads to healthier food options, then we will regulate. We're not afraid to regulate. I think the best outcome is that they lay us out a path that's credible and that gets us towards healthier food options. But they need to come to the table on that too. Family breakdowns in the wider picture, a lot of that has to do with economic circumstance. We've committed to increasing the minimum wage. That's one part of the picture. It's about meaningful work. It's about making sure people have access, affordable access to quality healthcare. Dental's one that's been raised in the last few days publicly, and we know that not only are people who can't access dental care that should subject to diseases they shouldn't get, but there's also social markers. When people go for a job interview and they don't have any teeth, it makes things more difficult. There are reasons to really focus over the medium term on getting more affordable access to dental care. One of the first priorities in that respect is making sure that those who are under 18 get the access that is already prescribed for dental care. So, everything pushes in that direction. I'll move on to your next question so that we do continue to have time, but I'm happy to have an ongoing conversation. I feel very strongly about these issues. Provincial health centres and the question of DHB amalgamation. Look, I'm interested in having a robust conversation around this. This is something I want to hear more on. I think we can make improvements. I think there's room for more shared services. I do, however, like, as my starting point, the democracy that DHBs represent locally. I do think that on the ground people have solutions that work in their area that won't necessarily work in other areas. And when you start to amalgamate up, you can lose some of that granularity. I'm always mindful of the example Oliver Hartwich, who heads the New Zealand initiative, gave to me, and it was based, I think, on his postgraduate research, that in Switzerland they had 3,500 rating agencies, and they decided there must be some efficiency gains, right? We worry about 20, whatever we have in New Zealand. Well, they had 3,500 and said, we must be able to make some efficiency gains. So they had an efficiency drive, and I think the number they got down to was 2,700 rating agencies in Switzerland. Now, you'd have to say that Switzerland's still quite a successful country, and it's got a very engaged democracy. So sometimes we chase efficiency gains that are not that lose something else, that lose engagement, that alienate people. So there's a balance to be struck there. And I do want to have a serious look at our model, but I'm kind of mindful of the tensions that sit within the existing model. I'll leave that one there. In terms of climate change, this government has signalled early that it regards that as an important topic to be a leader on. And Jacinda Ardern herself has said, this is our generation's nuclear-free moment. Climate change is real, and human beings have a part to play in it. And in my view, we need to make sure we're doing what we can to ameliorate the effects and also to stop the emissions. And I was actually personally a part of developing the emissions trading scheme behind the scenes. The year that I spent in a minister's office was actually in the climate change minister's office. And my primary qualification for being there, I suspect, was that I'd been at Treasury, not that I'd had a long political history, although it was theoretically a political role. And we worked through how an emissions trading scheme would work. Now, that scheme had been gutted under the previous government now, but we're making sure we set up an independent climate commission and look at carbon budgeting and so on. So we want to take that issue seriously again and make sure that New Zealand has a leading role rather than fast follower, which I think was pretty Orwellian, actually, not a very fast follower, if you ask me. Yep.
I'm not sure how many people have spotted the connection on the screen that's vital to a sector that's so short of money. But I think that's going to be one of the keys going forward, especially when we remind ourselves of what Professor Martin McKee said a couple of years ago when he came out from London. And this week, Lord Victor Adibawali spoke at Waitemata and said the same, that healthcare expenditure is an investment. So I think we're very lucky. Justin.
Hi, Dr. Justin Barry Walsh. I'm down here, right in front
right
of you.
there,
Yep.
right.
I'm a forensic psychiatrist from Wellington, and I've certainly got my own views and one or two little plans for things that might improve mental health in New Zealanders. But I'm very curious to know, you're going to have an inquiry into mental health. What questions are you going to ask? And who might you ask?
Thank you, Justin. I've said that I want that review to be broad. Now, Cabinet hasn't yet agreed with me on my vision for it, so I'll tell you what I think, and then you'll see how far I get with it. I think that we need to have a broad review. That's my starting point. I want to look at prevention as well as primary and secondary care. So, that is broad. I want to make sure that the people contributing to it are consumers, emergency services, clinicians, NGOs, anybody, family, whānau, whoever interacts with the system. Now, everywhere I go, there's somebody who says, well, we already know what the problem is and we know what the answers are. And I think we do know a lot of the answers, but when I ask those people what they are, they often come from different perspectives. I think it's time to make sure we've got a starting point that people agree on for the way forward from here. The other thing that's going to be a challenge is, of course, that these are not simple problems we have as a country. And when we as a government say we want to invest in mental health, and we do, people are going to say, but it's still terrible. 3 years on, what can you say has happened? Our suicide rate is still too high. Our mental health issues are still there. Now look, what I want to be able to say is, well, look where we started and look at the progress we've made. We need a starting point and we need a path that lays out where we put our investment so that we can see that we are making gains, because I think there's a huge amount of goodwill in the sector, but there are a lot of people who are stressed and tired also, and we need to give them the confidence that we have a path forward. So that's my starting point. Broad prevention, primary, secondary, and a broad range of voices. And we will invite submissions. We don't want to look at individual cases, but we want to look at how we improve our system. We've got things we want to get on with in the meantime. We've talked about nurses in every secondary school in the country. It's done in decile 1 to 3 schools. There's a whole research program that Simon Denny out of Auckland has done around that. Measurable gains. So we want to spread that across all schools. We want to have a pilot where we put mental health coordinators into primary care. It's a suggestion that's come out of the PHOs. And so there are things we know we can get on with in the meantime that make sense, because access to mild to moderate is hard right now, and why not make that easier to start with? But we also want to have a review that tells us what we're missing. Thanks.
Yes, thank you. My name is Neil Croucher. I'm a hospital-based dental specialist.
So was it Neil?
Neil Croucher.
Neil. Yep.
Hospital-based dental specialist in Northland and in Auckland.
Uh-huh.
You may have preempted some of the question coming this way from me today, but I do want to ask the question irrespective. First of all, though, thank you for your address. It was encouraging. I'm really encouraged by your desire to want to build a relationship with the sector, wanting to make a difference and to reduce inequality. So I want to thank you for that. It was encouraging. Look, I normally spend most of my time treating patients in hospital who have complex conditions, medical, dental, or have disabilities, physical disabilities, intellectual handicaps. However, each and every day, we get a steady stream of patients coming through ED and also directly to our hospital dental department who have serious dental infections, debilitating toothaches. I'd like to ask the question whether you'd be considering and introducing an affordable, accessible primary care general dental service for vulnerable and low-income adults across the country. I think you should. ED doctors think you should. And if you read her Twitter, your namesake Helen thinks you should too.
Yes. Yes, I'm expecting plenty more advice from Auntie Helen. Yeah, look, that is something that I want to explore and get good advice on. My starting point is I fundamentally agree with you. We've laid out, one of our challenges actually over the first term of our government is going to be meeting expectations in the sector, because the expectations are huge. We've laid out $8 billion worth of spending, and we've pretty much spent it in the promises we've made, or a lot of the things that we've already offered. There will be pressures and other things. We've allowed for some space. I've spent too long at the Treasury not to, but in the early years, if you look at our alternate budget in opposition, the spending is more moderate than you might think, and that's because of the way the previous government structured the finances. And we're determined to meet our budget responsibility rules that we've set ourselves. We don't want to be critiqued for just spending a whole lot of money without measurable gains or building up debt or whatever. We think it's quite possible to make real meaningful progress and meet those fiscal responsibility rules. So that's the context. I think you're right. I think that's the direction we need to head in. But I want to get advice from the department about how we build towards that. It will require, in my view, workforce changes too. That's one of the things that we'll need to look at, in terms of how we provide affordable access. And so there'd be hard conversations to have there about how we do that. And that's something I'd expect to engage on with your organisation. But we need to make sure that people are accessing the care that they need. And that's what I'm personally passionate about. So, perhaps you and I could also have a further conversation about this directly. A drink? Yes?
Thank you.
Excellent.
Thank you. We've got about 8 minutes left, so the last few questions, please try and keep them neat and tidy.
Kia ora, Minister. Thank you very much for coming. My name's Juliette Rumble-Smith. I'm a public health physician and Director of Health Intelligence and Translational Medicine at Northland DHB. I'm really pleased to hear that you're open to regulation. I think we've achieved a lot in some areas without it, and I'd really like for you to consider the adjunct of regulation in the areas of immunisation and in fluoridation, because we may need an extraordinary measure to lift it up to an adequate level in some of the areas. But my second question was around investment and how you felt around health analytics and the capability of our informatics infrastructure, with particular respect to the electronic health record project. I believe we've got a unique situation in New Zealand. We've got a national health identifier, which is fantastic. We've got a population that is trusting and believes in the benefit of integrated data. And we also have a willingness and openness around health tech. So in other countries, that's required quite substantial central investment, mandate and legislation. And I'm interested to hear if your government's also thinking about this.
Yep. So the first question, was that chlorination or fluoridation? Because we've also got an issue, of course, with our quality of water, quite aside from the fluoridation issue. Look, we all parties in government have committed to the fluoridation being shifted to DHB responsibility, which I think will bring a health lens to it. So I'd expect that legislation to continue through Parliament. The question of immunisation, I mean, I'll look at what the adjunct measures are that you speak of. My general encouragement is more is better, obviously. Herd immunity is where we want to be, and there are areas where that's not happening, and that is deeply concerning. And I think that people, the public, don't always understand that what the implications of not immunising their children is. I think we still have a job of education to do. Those of us in this room, I think, would all be of one mind, but the wider public still express doubts and concerns. There's a lot of misinformation, and that is a challenge for all of us, I think, because I think when you get to the point of compulsion, you have a whole different dynamic, and that can undermine trust in the health system. But we need to get better, and we need to keep pushing to get better. On health analytics, most of my roles since I've been in Parliament have been economic ones. Obviously, economic development spokesperson for the Labour Party prior to taking on health. I think associate finance is the only one I've had consistently through, but I've also had tax and small business and other things like that. And in my role as economic development spokesperson, I went and visited lots of the health tech companies. I think there's an opportunity for New Zealand there, both in terms of health outcomes and economically, to offset some of the costs in our system by being innovators and potentially sharing that IP more broadly as a gift to the world, but probably also as an alternate income stream. The electronic health record project, I'm awaiting a full briefing on that. I've got my first 100 days commitments that are absolute top of mind to get through to satisfy the public mandate we've been given. But that is one of the things that I want to better understand and make progress on. I've, of course, getting around the sector in opposition, talked to lots of people about their frustrations around that and alternate approaches, and I'm wanting to test them with my officials and also to continue to test them now in government with whomever. I have now the ability to talk with everybody about that and get the opinions, because I think, the NHI and the level of trust does put us in a unique position, and I think that we have a real opportunity to generate better healthcare options, and that's one of, effectively, it's a low-hanging fruit. It's not easy to get there, so I don't know, maybe it's a medium-hanging fruit, but it's a good-sized fruit. So I'm keen to tackle that. Thanks.
I think this will be the last question.
Okay, thanks. So I'm Julian Byers, I work at Starship. I'm a chest consultant there. I won't make this a question, I'll make this a bit of free advice, if I may, just being mindful of time. So one of the topics that's exercised this group in the past is the TPP. Yep. That obviously seemed to have been dead in the water a little bit earlier, and now I understand there's plans to rekindle it, but perhaps without the Americans. So my advice would be, talking of your comments before, going to your comments before about listening, I think this group and the colleagues that we represent will have strong opinions about the health consequences of TPP, not just around drug company, marketing, etc., but the social consequences of other forms of marketisation, etc. And I would strongly urge you and your colleagues in government to listen not just to medics, but to other health workers, other people who are concerned about the sort of clandestine nature of what was happening. Transparency, I think, is a key, but also that. So that's my two pence. Thank you.
I will respond to that if I can. One of my previous roles, aside from economic development, most immediately was as our trade spokesperson. So I watched and inserted myself into the select committee process for the TPP hearings. And I have a strong view about transparency. I share that. And one of our concerns and criticisms of the previous government, and I think in part the person who was their trade spokesperson that led it, was that there was a lack of engagement, if I can be that personal. And I think many people in the National Party, whether they agreed with it at the time or not, now look back and say, actually, wider public engagement was important and we missed out on that. I went on a delegation overseas where we talked with other countries involved in the TPP. This was with the Speakers Tour, and it became apparent that other countries had done this much better than we had as a country, in terms of ensuring that people understood what trade-offs were and getting input from union representatives, from business people, from academics, and really taking the whole picture to the negotiation, because I'm not convinced that happened. And we set out some principles and actually became very unpopular for our stance opposing the TPP. That was the first trade agreement the Labour Party has ever stood against. The first Labour government was pushing trade access in the UK. So the Labour Party has agreed with every trade agreement up till the TPP. And the reasons we outlined started with owning, or the one that was most obviously breached was around allowing non-resident foreign buyers to purchase land in New Zealand. People had no intention of living here, only were using it as a buy and sell device, which unsettles the market, makes it out of reach of more people, and so on. We said those traders should not be allowed to buy homes, and several other TPP countries had it explicitly excluded in their side of the agreement. We didn't even ask for it as a country. So, the social consequences were not even considered. We're not even in the negotiating mandate. It wasn't like it got rejected. It was not even in there. And so, I could talk about this at length. I feel passionately about these issues. There are social consequences. We are a trading nation, and I'm not ready to give up coffee or bananas. I'm being upfront about that. And I think our country would be in a difficult position if we didn't take foreign currency for tourism, or if we didn't sell dairy products overseas. We would not be able to afford the healthcare sector we have. So we will trade, but it's about the nature of that trade and how we look after our population and share the benefits of that trade.
Thank you. I'm going to draw this session to a close.